notice that the current AMR response, it doesn't explicitly include children. For example, none of the World Health Assembly resolutions specifically mention children. And so we're concerned that children's needs are also met as we look at response to AMR. The current global AMR response is focusing on restricting access to antimicrobials because overuse and inappropriate use is driving the AMR epidemic. Whereas when we look at low and middle income countries, and particularly children in low and middle income countries, we see that more of them die from lack of access to antimicrobials than from AMR resistance. And so we're very concerned about making sure that we have the right antibiotics when we need them, but we don't overuse them and drive more of the epidemic. We're very fortunate that many countries have taken up the mantle of antimicrobial resistance and developed national strategic plans to battle antimicrobial resistance. And implementation research is a tool for getting the global and national policy to the local level, because it often takes an iterative response of testing and learning and testing and learning and changing and improving the quality of care. My Chief of Health, Dr. Stefan Peterson, he often says it's fixing the plane while you're flying it as opposed to waiting for the end line crash. And so that you basically have an iterative approach and you keep fixing things that aren't working. We basically have two initiatives currently. The first is that UNICEF is developing strategic guidance on response to AMR, with especially looking at children. It'll look at both access, but it'll also look at prevention such as sanitation and hygiene, and we'll also look at new diagnostics so that we can better tell when and what antibiotic is needed. We're also very excited by a new partnership with the Wellcome Trust, where we're going to be doing implementation research around implementation of antimicrobial access and stewardship, particularly at the local level. Here in Bangladesh, we have a current implementation research project happening in Cox's Bazar, in the migrant camps there. And one issue that has come up as a concern in the maternal, newborn, child and health community is excessive use of antibiotics, for example, for diarrhea or pneumonia in children. And so we're currently exploring adding that topic to our implementation research. UNICEF, along with the World Health Organization, UNDP, and the World Bank, is a co-sponsor of TDR. So we're very excited to be able to work with TDR on their program in antimicrobial resistance. Because we know TDR has a global network of trained implementation researchers that we want to work with. Because in our approach, we like to pair the local implementer, the local program manager, with a local trained implementation researcher so that they can work to face local challenges and improve the health of their communities. We want the approach to be complementary so that we can, through this research, we can reach more countries and that we can encourage South-to-South and global sharing of the lessons learned so that children are included and the specific needs of children and the variation in local communities can be accounted for in our work.